Hello, once again. I'm David Dirks, the Director of Meetings and Events for the National Alliance to End Homelessness, and welcome back. Welcome back to day two. I'm curious to know how the event is going for all of you. I'm curious to know which sessions you really liked, what speakers you really liked. Some of the sessions that stood out to me include, of course, the Housing First session. Shout out to all of our wonderful speakers in that session. Listening to the people we serve. Some of the Consumer Advisory Board members on the from the Alliance were just absolutely amazing in that session. Also, I saw a lot of chatter and talk about the using your data on racial disparities to inform systematic and programmatic change. I thought all of the sessions were amazing yesterday. So definitely in the chat box, just let us know what sessions you liked. We obviously wanted to make sure we put on a great conference. So let us know how it's going. We want to hear from you. Also, let's just go right into it. Let's begin. This amazing second day. You guys are in for a treat today. This plenary is full of powerhouse friends, people that have been committed to ending homelessness for most of their careers. And the first person that I have the honor of introducing is Amanda Andere. She is the CEO of Funders Together to End Homelessness.
I feel a great joy to be with you here today. I am the CEO of Funders Together to End Homelessness, a national network of philanthropy rooted in racial and housing justice. But all day, every day, I'm a Black woman who survived the last 4 years. And for that, I am grateful and filled with joy. If you know me, you know I believe that no matter how hard our work, no matter how hard life is, we need to find joy. Joy is the resistance to the oppression we face, that despite pain, we will have joy because our lives matter. I've not felt that joy for a while. I've not been able to utter the words hope a lot this past year, but I'm gaining back my hope. Real change for me comes at the intersection of hope and boldness. I don't have hope just because we have a new administration. The new administration is for sure a relief, but it does not erase structural racism and injustice. We know it will not magically end homelessness unless we put in the work. But that is why I have hope. Recently, one of my favorite leaders and friend, Dr. Tiffany Manuel, or Dr. T as some of us call her, said, "Housing will test white support for Black lives. Housing is fundamental and the foundation on which other systems are built." Folks, that should get us fired up and full of hope. The possibility of demonstrating what I know, what you know to be true. Black lives matter, Indigenous lives matter, marginalized folks don't have to prove their humanity, and we can clearly articulate that fact by our commitment to end homelessness through housing and racial justice. It might not feel bold for us to say that everyone deserves a home, but for this country rooted in stolen land and chattel slavery, where home was constantly ripped away from folks, it is bold. And I believe we can get there. Something in the atmosphere is shifting and it gives me hope. As some of us don't regulate Black history to 1 month, and we don't just celebrate Black history, but think about Black futures. What does it mean to be in a liberated state? I spent the month of February thinking about my vision for how we can end homelessness through racial and housing justice. We must stop saying this is not America. For some of us, this is the only America we have known, full of injustice, bias, deep pain, and trauma. But it is not the only America that is possible. In the America that is possible, I believe philanthropy will start to dismantle itself and turn over resources and power to community, recognizing it was actually never their money to begin with. Philanthropy, traditional nonprofits, and advocacy will learn the lessons some of us saw in the Deep South this past year, that organizing and activism is the only thing that can shift the power dynamics of our political environment. And when that happens, when we actually believe and trust community and resource people like we want folks to win, it will lead to the dismantling of the nonprofit industrial complex that we all benefit from and enable, that makes us gatekeepers to power and resources for the people we say we care deeply about. I know that makes some of us feel uncomfortable, but we can't achieve racial and housing justice if people don't have the ability to get what they need in a way that does not continue to traumatize them. We have to wake up every day and say, what are we doing with our privilege? What are we willing to give up? We can't just say we need to reimagine our systems and be unwilling to give up something to get there. That is the daily work that will end homelessness. That will be the beginning of racial and housing justice for the reimagined America that is possible.
Just wow. Few things stood out to me when Amanda spoke. Finding that joy again. I speak about that a lot. We have to find our joy, and we have to do this work while ensuring that we are helping the people that we care so much about. So thank you so much, Amanda, for your words. Your leadership is so valuable to the work that we all are doing. And we also know that many of you are also in this fight to ensure that racial equity is at the forefront of the work that you are doing. So let's hear from more people throughout our field on the work that they're doing to improve the lives of the people in their communities.
The overrepresentation of Black people among the homeless
is due
to systemic
racism.
Black Angelinos make up 8%
of the general population,
but they make up 34% of those who are homeless. In order to truly end homelessness, it is important to center equity in homeless policy and program development.
I do this work because I want to use my talents to give back.
I do this work because if I won't, who will?
I do this work as an advocate for individuals that are afraid to speak for themselves.
I do this work because of the 1%, the indigenous happiness of the Americas.
I do this work to inspire, empower, and help my community.
I do this work because as a person that was once homeless, I enjoy seeing the clients that we house.
I am Chelsea Andrews, Alameda County, California. I'm extremely proud of the work our community has done to center racial equity in our homeless system design. We recognize that without being intentional, we would continue to perpetuate structural and systemic racism in our community, resulting in disparities. We recognize that this is just the first step of many, but we are laser focused on working together as a community to ensure equity in our system.
David Hewitt, Hennepin County, City of Minneapolis. I do this work because all people deserve a safe and dignified place to call home.
Hello, I'm Dawn Gilman, the CEO of Changing Homelessness in Jacksonville, Florida. We're working to end homelessness in the middle of a pandemic because housing is healthcare. And that's how we can help keep everyone safe.
My name is Yolanda, Mateo, Director of Client Services at the Open Door Shelter in Norwalk, Connecticut. I'm fighting to end homelessness because I believe everyone should have a chance to be stable in their own housing situation. Trabajo en el Open Door Shelter en Norwalk, Connecticut. Este trabajo es importante para mí porque yo creo que todo el mundo merece tener una vivienda segura para ellos.
It is truly amazing that so many across this nation are retrofitting or tearing down their systems, reimagining their services, and organizations to address disparities within the homelessness system. Now, for an inspirational conversation bound to put a huge smile on all of your faces, please join me in welcoming Tiana Kelly, Development Coordinator for the National Alliance to End Homelessness.
Thank you, David. I'm Tiana Kelly, Development Coordinator for the National Alliance to End Homelessness. And today I'll be talking with an amazing young man who went on a mission to raise awareness to help end homelessness. Gordon Wayne was featured as Person of the Week on ABC News, and today we're going to talk to him to find out what inspired this campaign. Please join me in welcoming Gordon Wayne.
Thank you. It's a pleasure to be here.
Thank you. How's it going, Gordon?
It's going great. Just a little windy up here, but how are you?
Good. Really good. Thank you. And glad to have you here. So let's jump right in. What gave you the idea to walk all the way from Virginia to Massachusetts?
So after I had experienced the problems that come with homeless, which includes the lack of food, lack of water, lack of any resources, including shelter, cleanliness supplies, and I'd gotten accepted to Boston College, which meant I wouldn't have to be concerned with these issues anymore. So I wanted to find a way to give back, but I didn't want to just ask people to donate. I wanted to do something to show how passionate I was about the cause. So one day the idea popped into my head and I couldn't let it escape me without doing it.
Mm-hmm. So can you tell us what the journey was like walking all the way up the East Coast? Did you have any noteworthy experiences or any special memories?
So honestly, I equate the journey a lot to my experience with homelessness, because the beginning was the hardest part when I was not adequately prepared. Much like when I was homeless, I didn't know where to go. And with this journey, I didn't have the proper equipment. So for the first few days, my feet blistered beyond belief. And then because I'm not 21, hotels aren't like normally hotels only allow people above the age of 21 to stay at them. So I would have to convince the front desk worker at the hotel each night to let me stay. And on the second night, they wouldn't let me stay. So I ended up sleeping on the sidewalk, and then I snuck into Planet Fitness to get a shower. But after that experience, I realized I needed some new shoes because my feet were too injured. So I got some medical supplies, I got some new shoes, and I was able to really manage my blisters. And I got into a routine where I was walking 15, 16 hours a day, and I was able to repeat it and make it up here safely.
And we're glad you did, Gordon. So it sounds like you had to be pretty resourceful and learn how to figure things out. What was that like?
Being homeless really taught me how to become an adult, because I had to do everything for myself. I had to figure out how I was going to go to school, how I was going to stay alive, how I was going to stay safe. And that really allowed me to be able to do this journey, because it allowed me to have a certain mental fortitude that I wouldn't have been able to have without the difficult experience of being homeless.
Mm-hmm. So, Gordon, during your journey, you got plenty of support through GoFundMe, through Instagram, and other social media. What was that like? What was the support you received like? And when did you know that it was becoming something really big?
So I started to get a lot of support on my way. Like, I'd say when I got into Pennsylvania was really when it started to come in. And it meant a lot to me, because first of all, it was inspiration to keep going at a time when I was seeking for any source of inspiration to keep going. And along with, the people I was walking for, it was the second greatest source of inspiration for me, because, I had all these people who were rooting for me to complete my mission, and it made me want to quit even less than I did before. So it meant a lot because of that, and also because, just the sheer amount that was raised for these people that I really want to help. is unfathomable to me. And all I can say is thank you to the people who donated.
Yeah. Yeah. So what inspired you to document your journey through photographs on Instagram, just looking for ways to stay motivated throughout your walk?
Yeah, so that was part of it, especially at the worst times. But the major reason why I chose Instagram was because I really knew the platform, and I felt like it's how I could get my word out, get the word of the journey out to the public, so they could help support it and spread attention to other people through word of mouth. So I was kind of able to get both of those, just awareness and then also support that I really needed at the time to finish my journey.
Yeah, and there ended up being plenty of both. So,
yeah,
Gordon,
all I can say is thank you. It really meant a lot to me, and it still does.
Yeah. So you've been at Boston College for just over a semester now. What's that been like?
It's been a complete culture shock for me. I've never been in a big city for a prolonged period of time before. I'm from a rural area in Virginia, so it's much different because of that. And then also because of the COVID pandemic, of course, that's affecting everyone. And a lot of people much worse than me. But it's still been a great time because I'm at a great school with beautiful buildings and great administrators and great teachers. And I feel like I'm learning the financial education I need to try to help solve this issue that I care about so deeply even further.
So I know you've mentioned we've pretty much been in the pandemic as long as you've been at Boston College, but have you had the chance to explore the city, get to know the area?
So I've been trying to mitigate the possibility of getting COVID as much as possible because I don't want to be in quarantine. So I haven't really explored the city too much yet. But once COVID is gone, I'm going to be all over town. That's for sure.
Yeah. So Gordon, what do you hope anyone who hears about your journey is able to take away from this story? What impact do you hope that you have?
Well, so for the people that are receiving the money or should receive the money, but there's just not enough of it to give to everyone who is homeless, I want them to know that you can still achieve your dream even though you're experiencing some very difficult circumstances. And no reason is good enough to give up on your dreams. And that applies for everyone, not just people who are dealing with monumental struggles, but everyone can achieve their dreams if they believe they can and if they put in the work needed to do so. And then also, I just want people to treat each other with more kindness. For example, we clearly have such great comfort in our lives because we're able to talk to each other online, even though most people in the world and obviously throughout history have been unable to even think about doing something like that. And there's a lot of people in the modern world right now who don't have the ability to get on the internet or even, feed themselves and get the resources they need to survive. So I think as a collective, if all of us who have great comfort in our lives and are able to give to others, if we all do so, then it will make our world a much better place. And I mean, it's just what we honestly should be doing.
Yeah. Yeah. Those are some incredible words of wisdom, Gordon. Well, your GoFundMe campaign, Gordon, raised over $172,000 for the National Alliance to End Homelessness, which we will be re-granting out to help people who, like you, are currently experiencing homelessness or like you formerly did. What are your feelings on all of that?
Man, it's just incredible to me. I could have never imagined that or anything close to that. I would have been happy with any amount of money because, to know that I did something that could help other people achieve their dreams it means the world to me. Like I really can't I don't think I can explain it correctly with words.
Yeah. Well, thank you so much, Gordon. We really appreciate you and all that you have done. Any last words?
Stay safe and God bless.
Thank you. All right, David, back to you.
What an amazing young man. We all should be inspired. We all should be trying to do more. There are many Gordons in the world, but we are very grateful for that young man, for what he has experienced, for what he is going to achieve in life. So, Mr. Gordon Wayne, remember to always fight for your dreams, as you said, and much success to you in all of your future endeavors. Switching gears just a bit, it is no secret that the COVID-19 pandemic is disproportionately impacting Black, Brown, and Indigenous communities. Join me in welcoming Dr. Virginia Caine, Director and Chief Medical Officer with the Marion County Public Health Department in Indianapolis, Indiana, who will share her thoughts on equitably addressing health disparities and access to the COVID-19 vaccine.
So thank you so much for having me today at the conference, and just exciting to hear what's going on. But let me just say, since this epidemic hit us about basically 1 year ago across the United States, people of color have been contracting and dying from COVID-19 rates way higher than white people during this pandemic. And now, despite that, when we saw this epidemic first started, we saw high rates of cases occurring like in states of Louisiana, where maybe 28% of the population was African-American, but contributing for 70% of the deaths. And saw similar rates in New York, Illinois, and even local counties such as Indianapolis, where 30 to 40% of our cases were found in our Latinx population, followed by our African Americans. And although we only see 28% Blacks in Marion County, we were seeing twice the death rates and hospitalizations compared to our white counterparts. And even if you go as far as the Native Americans, the Navajo Nation, when you looked at their rates, and although they made less than 5% of the populations in Arizona, Utah, and New Mexico, they contributed to 20% of the COVID-19 cases. And so just based on that data, that we now see that African Americans, Latinx populations, our Native Americans are having like 2 times the rate of cases compared to their white counterparts. They're having 4 times the hospitalization rates compared to their counterparts, and they're definitely dying at a much higher rate. Now, how does this equate to what we're also seeing across the nation? We are seeing that a significant number of our homeless populations are made up of different racial and ethnic populations, particularly the African American, that we see that contribute to over 40% of our homeless populations, followed by our Latinx populations, and even issues such as on some of the Native American reservations, they may not always have running water. And so making it very difficult to curtail their infections related to that. So when we see the increase in the homelessness related to the COVID-19, because of loss of jobs, a lot of our racial and ethnic minorities have a higher poverty rate. And as a result of the higher poverty rate, sometimes those in their frontline jobs where they're not able to telecommute, they have to get on public transportation. And as a As a result, some of them have been evicted from their homes or not being able to pay for their mortgages of their homes. And so a significant amount of homelessness consists of our different racial and ethnic populations. Now, even more frightening than that is the fact that despite having lack of ability to get access for testing, access to healthcare, we're now seeing that when we do have a wonderful tool with our vaccinations, they are unable to get vaccinated compared to their white counterparts. When we look across the country, we're finding that, for example, Indiana, our Black Indiana residents make up 10% of the state's population, but they only accounted for 4% of being able to get vaccinated. If you come to a large metropolitan city like Indianapolis, Indiana, 24% of our county's population is Black, but they only, 28% of our population is Black, but they only receive 14% of the first dose. Go to Lake County, where they make up 24% African Americans. They only receive 11% of the first vaccine doses. We're seeing this across the country, where we're disproportionately getting vaccinated. We're seeing that our homeless population disproportionately getting vaccinated. So I tell all of you out there, you advocates, people in the business of providing shelters, you've got to make sure that the resources are getting down to the people who are the hardest to reach and the most vulnerable. What does that mean? We need to come to you to do our vaccinations for the people that are hard to reach. It is just significant and crazy to expect our homeless populations, with the lack of resources, to come to our traditional hospital systems, our traditional clinic operations, and for those who don't even have access to a doctor, in the cost associated to maybe going to an urgent care, we need to strongly advocate that partner with your local health departments. Get out there and have vaccinations taking place in the shelters or places where they commonly congregate. But the most other important point is, please provide stable housing. And it shouldn't take 90 days from once they get into a shelter to find that stable housing. We've got to do metrics to monitor how well we do related to this epidemic. We should be able to do it in less than 30 days. Make it happen. So, stimulus dollars out there, be talking to your policymakers, be talking to your mayors. Make sure critical resources are going to the people we desperately need to reach, who desperately need these resources the most, and they need you to advocate for them. Thank you.
What an amazing call to action from Dr. Caine. Thank you so much for those words. Thank you so much for your leadership in Indianapolis. And thank you very much for all of the work that you are doing to ensure that our communities remain safe and get vaccinated.
And Dirk, I know I just had 5 minutes, but let me just say this.
Sure.
I had a new revelation as a health officer. Let me tell you, I got into the homeless business. I had no clue the serious difficulties that our homeless populations were facing.
Absolutely.
I've rented 6 motels. I've rented a hotel. If I can do it, every local public health department can do it in this country. Have them match me if they're not doing it. Thank you.
Thank you. Thank you, everyone. Thank you. Let's give our thanks to Dr. Caine for her remarks. Thank you for joining us today. Now, we are going to move this plenary right along. Have some very wonderful guests next. Our first guest is Mr. Richard Cho, who is the Senior Advisor for Housing and Services at the U.S. Department of Housing and Urban Development.
Hi, I'm Richard Cho, Senior Advisor for Housing and Services at the U.S. Department of Housing and Urban Development. I want to thank the Alliance for the opportunity to speak today and for your remarkable work year-round towards preventing and ending homelessness in the United States. And thanks to all of you for participating in this year's virtual conference and for your own tireless efforts around this critical mission. The past year has been devastating for our most vulnerable communities. The COVID-19 pandemic has exacerbated our nation's homelessness crisis and posed unique challenges to people experiencing homelessness. We at HUD fully understand the enormous challenges and risks that people experiencing homelessness have faced due to COVID-19. For instance, people in shelters are at risk of outbreaks because their crowded congregate settings make it virtually impossible to physically distance. Unsheltered people have been left with fewer options, with shelters at lower capacity, and with libraries, soup kitchens, and drop-in centers closed. And with many schools having gone virtual amid the pandemic, many students and youth experiencing homelessness have struggled to access necessary resources and support services. We also know what amazing work was done by continuums of care and homeless service providers across the country, from engaging with your public health authorities and building healthcare partnerships, to creating non-congregate shelters and isolation facilities at hotels and motels, and increasing homeless outreach. You all stepped up to the crisis and adapted to the moment in incredible ways to protect people experiencing homelessness from a new public health emergency layered on top of the longstanding public health emergency of homelessness. And just as you've adapted quickly in the face of crisis, HUD is adapting our agency to meet the many challenges of this moment. We're working hard to improve HUD's efforts to connect people that our programs serve to COVID-19 response efforts, with a particular focus on vaccines. HUD is doing our part within the Biden-Harris administration's mobilization of a federal government-wide COVID response to ensure that people experiencing homelessness are prioritized and given access to vaccines. We are continuing to help communities strategically use the resources that were provided through the CARES Act and in the December continuing resolution, including $4 billion in emergency solutions grants, $5 billion in community development block grants, $43 million in special vouchers for people experiencing homelessness, and more. And we're working with other federal agencies like FEMA and the Department of Treasury to help communities match the right resources to the right needs. HUD's program offices are working quickly to extend and add additional regulatory flexibilities that make it easier for communities to meet the needs of people experiencing homelessness, while protecting in-housing and homeless services programs. Our focus at the moment is on helping you use the resources to continue to protect people experiencing homelessness from COVID-19, while also stepping up efforts to connect people back to stable, permanent housing. After all, while hotels and motels, masks and social distancing are critical to minimizing the spread and protecting people's lives, the best tools that we have to keep people experiencing homelessness truly safe from COVID-19 are vaccines and a home. We must all get back on track with our mission of helping people obtain permanent housing as quickly as possible, without barriers and preconditions. We must double down on the housing first approach, which has been proven through science and evidence as the best solution to ending homelessness. And we must do all of that with an eye towards equity, acknowledging the long-standing disproportionate impact of homelessness and COVID-19 on communities of color. The Biden-Harris administration has been clear that the housing first approach is once again the centerpiece of the federal government's response to ending homelessness. Moreover, the administration is committed to implementing that housing first approach with a focus on advancing equity and reversing systemic racism. You see the housing first approach reflected in the American Rescue Plan, which calls for $5 billion in emergency rental assistance for people experiencing or at risk of homelessness. It also calls for $5 billion in home investment partnerships funds that can help communities create supportive and affordable housing, including through the purchasing and conversion of hotels. We hope that Congress will act swiftly to help Americans get the relief they need and to ensure that all of you have the resources needed to help people experiencing homelessness get safe by getting home. Thank you again for your dedication and tireless work to make a real difference in people's lives. We at HUD look forward to our ongoing partnership.
Thank you, Richard. Now I would like to introduce Anthony Love, the Interim Executive Director of the U.S. Interagency Council on Homelessness.
Good afternoon. I'm Anthony Love, Interim Executive Director of the United States Interagency Council on Homelessness, better known to a number of you as USICH. First, I would like to thank Nan and the remarkable team at the National Alliance to End Homelessness for this opportunity to speak with you today and for the incredible work they do every day to prevent and end homelessness in the United States. Also, I want to say thank you to the team at USICH and to all of you for your efforts and commitment around this critical mission. Let me start my remarks by saying that the mission and purpose of USICH is to coordinate and catalyze the federal response to homelessness, working in close partnership with and across our 19 federal member agencies and with national, state, and local partners and stakeholders. USICH will fulfill this mission by supporting and encouraging the implementation of evidence-based practices, which includes housing first strategies. The Biden-Harris administration has been clear that ensuring that the necessities of life, such as having a place to live, are expediently and adequately met. In other words, and in case you have questions, I want to assure you that this administration is committed to making sure our country commits to a housing-first approach to ending homelessness. Additionally, USICH understands and believes that by working to create structured resource partnerships between and among federal agencies is not only smart, but necessary. Also, we recognize that by working with cities and states through our exceptional and capable regional team who assist communities to use federal resources in the most effective and efficient way, will set the stage to ensure that homelessness consistently decreases. Moreover, years of data indicates that homelessness is disproportionately high among Black, Indigenous, and people of color. These disparities, of course, look different across communities such as African Americans, Native Americans, Alaska Natives, and Latinx populations, among other populations. Therefore, it is vital that homelessness service systems examine all policies, priorities, and strategies and ensure that they are implemented using a racial equities lens and ensure racial inequities do not continue. That is why the administration believes that we must focus on policy solutions at the federal, state, and local levels, as well as within homelessness service system in ways that address structural racism and actively dismantle disparities. I would be remiss if I didn't acknowledge and recognize the extraordinary efforts that you in the field have put forward to help those women, men, and children who are homeless during this pandemic. I want to thank you for your commitment, your compassion, and the care that you have given to those individuals and families who are already struggling with not having a permanent place to call home. And now, not only do they have to worry about having a place to call home, they have to worry about this while not trying to contract a virus that has killed over 500,000 Americans. So I want to say thank you and acknowledge the incredible work being done by continuums of care and homeless service organizations across the country. From engaging with your public health authorities, working with your local VA medical centers, homeless staff, and building other healthcare partnerships, to creating non-congregate shelters and isolation facilities at hotels and motels and increasing homeless outreach, all in the name of helping those individuals and families who need us now more than ever. I want to encourage you to keep up the good work and to continue to prioritize linking individuals and families to permanent housing as a solution, not only to ending their homelessness, but also providing a safe refuge from the virus plaguing our country. So thank you again for your dedication and your tireless work to make a real difference in people's lives. I am thrilled to speak with you and look forward to working with you to further the Biden-Harris agenda for ending homelessness. Thank you.
Thank you, Anthony. We are very excited to continue our work with you and USICH. Next, please join me in welcoming Tim Marks, who is the Vice Chairman of the Alliance Board of Directors and President Emeritus of Catholic Charities of St. Paul in Minneapolis.
Good day, everyone. I am Tim Marks. I am the Vice Chair of the Board of Directors of the National Alliance to End Homelessness. I have the privilege of introducing the Honorable Denis McDonough, who was confirmed by the Senate as the 11th Secretary of Veterans Affairs on January 27. He is held in high regard in his home state of Minnesota, where he grew up and attended St. John's, the same small Benedictine college I did, before receiving his master's from the Georgetown School of Foreign Service. Secretary McDonough has had a distinguished career in public service. In the Senate with leader Tom Daschle, Senator Barack Obama, then the National Security Council in the Obama administration for the first term, and then Chief of Staff for President Obama's entire second term. Of the 30 people who have held the Chief of Staff position since the Truman administration, only 5 others have served an entire presidential term. We should be grateful that we have a VA secretary who has such deep and broad federal government experience and influence at the highest levels. He has profound respect for our soldiers and veterans. He's committed to solving homelessness. He is the only Chief of Staff to ever personally participate on the streets in a point-in-time count. And at his confirmation hearing, he made clear that focusing on ending veterans' homelessness is a top priority of the Biden administration. Here is what President Obama wrote in his recent memoir, A Promised Land. Even in a team of type A personalities, Denis stood out. He sweated the details, volunteered for the most difficult, thankless tasks, and could not be outworked. Before Obama was inaugurated, McDonough insisted that Obama be able to demonstrate respect to soldiers and veterans. "We need to make sure you can deliver a proper salute," McDonough said. McDonough then acutely observed every detail of the lesson provided by 2 soldiers. "Elbow further out, fingers together," Obama was told. After 20 minutes, the soldiers approved, and Obama asked McDonough, "Anything else you were nervous about?" McDonough replied, "Not nervous, Mr. President-elect, just want to be prepared." "For what?" Obama asked. "For everything," McDonough replied. "Mr. Secretary, we salute your public service and are prepared for everything required to be foot soldiers in ending veterans' homelessness." Secretary McDonough.
Tim, thanks for that kind introduction. Nan, Jeff, and Gary, thanks for the opportunity to join you. And to everyone on the National Alliance to End Homelessness team, thank you for the magnificent work you do for this country, for all those struggling with homelessness. As White House Chief of Staff, I learned that when it comes to shaping the right policies to address homelessness in America, it's important to have NAEH at the table. You bring the collaborative power of all the public agencies, private partners, and more than 10,000 providers that you represent. You bring the enormous collective power of your institutional knowledge, lessons learned, and best practices about what works and about what doesn't work in addressing homelessness. And underlining all of this is the most important common denominator, your deep and abiding compassion for all people. The goodness you represent inspires me. I'm grateful you're one of VA's most important partners in the fight to end veteran homelessness. I look forward to strengthening that partnership. And I'm committed to making even greater strides toward ending homelessness. Over the course of the last decade, our country has seen a decline of about 11% among the homeless, and a nearly 50% decline in veteran homelessness. 3 states and 81 communities have announced an end to veteran homelessness. But for any person or family homeless tonight, veteran or otherwise, those numbers don't mean a lot. I know we all agree. So we have a lot of work to do, and to do together. President Kennedy's words bear repeating here. By working together, a rising tide lifts all boats. Together, we have to take inventory of models that work, models and systems of interventions that move people from homelessness to housing, models that provide immediate access to housing, and connections to a range of services that facilitate the transition from homelessness to stability, and models that answer the needs of all people, whether they're briefly homeless from a string of bad luck, or on the streets for years because of severe disability, needing long-term subsidies and extensive medical care. For VA and veterans, we'll continue to depend on some proven models. HUD-VASH that prioritizes chronically homeless, veteran justice programs and treatment courts, supportive services for veteran families, homeless providers grant and per diem, community resource and referral centers, robust data analytics, and research assessing the effectiveness of our programs. And we'll keep identifying and sharing best practices with all of our partners. One best practice among many that excites me is our Cemetery Apprentice Program. This apprenticeship is a joint effort between our National Cemetery Administration and our Health Administration's Homeless Veterans Community Employment Services. The program provides veterans who are homeless or at risk of homelessness entry-level technical training on cemetery caretaking and permanent employment in our national cemeteries. Apprentices learn personal financial management and conflict resolution too. That's a big part of veteran David Lowe's success story. Thanks to that apprenticeship program, Housing First, and our people at the Dayton VA Medical Center, David went from homelessness to a good job as a caretaker at the Dayton National Cemetery. Today, he's helping keep watch over the nearly 50,000 veterans and family members resting there. And David is just one of 85 veterans that apprenticeship program has helped. And Housing First will remain our flagship for addressing homelessness for veterans. Here's why. Housing First is a proven principle. Housing First, coupled with initiatives like HUD-VASH, puts veterans on the path to permanent housing and decreases the risk of housing instability. Housing First is humane. It's a dignified way to help veterans achieve the stable, permanent housing every person deserves. It's thanks to Housing First, HUD-VASH, and VA employment services that veteran Derek Chapman overcame years of instability and homelessness. With the help of great people at the Jesse Brown VA Medical Center in Chicago, Derek found a steady job he enjoys, married the love of his life, and last November, bought a home. Derek said, "I'm very grateful for the VA programs. Without them, I wouldn't have been able to accomplish what I have." And there's veteran Marvella Jackson. After losing her job, Marvella and her children fell into a cycle of homelessness. Thanks to Housing First and our people at the DC VA, Marvella and her children are in a home, and she has returned to work. Marvella said, "This is the kind of stability I've never experienced. This place is such a blessing." So Housing First will lead VA across every aspect of our services for homeless vets. It is essential for success, and it's about keeping promises. As I testified in my confirmation hearing before Congress, President Biden has given me a clear mission. That's to be a fierce, staunch advocate for veterans. And I testified that he has, among other top priorities, directed me to keep focus on working to eliminate veterans' homelessness. That's work I embrace, and here's what I know about it. When it comes to eliminating homelessness, I know it's work I can't do alone, that VA can't do alone, that no single person or agency can do alone. The outcomes we've seen for veterans are the product of strong support from elected officials and powerful advocacy from people like each of you. I know we have to keep depending on one another for the sake of those who need our help. And I know that no matter which population of homeless people we're helping, meaningful progress will take coordinated, collaborative interagency work at any level we're serving, whether that's local communities, municipal level, state, federal, or a combination of those. It will take strong, committed, and innovative leadership at every level. And we all know that it will take resources, human, material, and fiscal, that are adequate to answer the needs of the homeless. President Biden's American Rescue Plan will make a difference here. It's a testament to President Biden's commitment to helping the homeless, tenant-based rental assistance, development and support of affordable housing, supportive services, housing counseling, and prevention services for the homeless and those at risk of being homeless. And I know this, given the extraordinary wealth of this country, given the immense resources, tangible and intangible, the ingenuity and innovative spirit, it's a tragedy, an avoidable tragedy, that there are people in this country without homes. Everyone should have a home. Every veteran should have a home. Listen, Veterans didn't serve this nation, didn't make the enormous sacrifices they've made, didn't sacrifice their lives on the altar of freedom so the people they were defending could be homeless, so that they or their fellow veterans or families could be homeless. And that's why I'm going to fight like hell every day to ensure we serve veterans as well as they have served this country. And I'm going to do everything I can to help this alliance achieve your mission of ending homelessness altogether. God bless all of you, and may God bless our troops, our veterans, their families, caregivers, and survivors, and may we always give them our very best.
Many thanks to Secretary McDonough for those amazing remarks. Personally, I think it's absolutely refreshing to have an administration that wants to be a partner with all of us and do the right thing. This is an opportunity for us all to get this right finally. That concludes our plenary today, but I do have a few announcements before we go. Remember to join us for the networking this evening at 5:05. We added a special session for all of our lived experience advocates. It is entitled Change Makers Lived Experience. You should see it on our platform. If you click networking, you should see all of the available rooms for this evening. In that particular room, our lived experience advocates will have a chance to discuss with each other, Nan Roman, and other Alliance staff. Also, we'll see you in the breakout. They begin right at 1 o'clock. So 1 o'clock Eastern to be exact. So please don't take too long of a break. Make sure you go into the session that you want to go into for the next round of workshops. Tomorrow morning, join us for yoga at 11. Many of you enjoyed the meditation session. So be sure to come back and join us tomorrow for yoga. It starts at 11 a.m. Eastern Time, 8 a.m. Pacific. Once again, thank you for joining us today. Have a great conference.